And welcome to the Dr. Bob Show. We'll be spending most of this show talking about the fourth leading cause of cancer death in the United States, cancer of the pancreas. And if we can find the diagnosis early, there is a chance that we can help the patient and have a cure rate. We'll be finding what it takes to diagnose cancer of the pancreas early. My guest is Dr. Matt Moore. Dr. Moore is a board-certified stomach specialist, gastroenterologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about heart failure. Could you have some heart failure and not know it? And I want you to learn the word microbiome. It's going to be a favorite word in time to come. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Matt Moore, board-certified gastroenterologist, and we're talking about cancer of the pancreas. Matt, welcome to the Dr. Bob Show.
Thank you for having me, Dr. Bob.
Tell me about the pancreas in itself. Where is it located?
So the pancreas is a gland, which means it's a solid organ that secretes substances. It is about 6 inches long, and it sits in the upper part of the abdomen. It is right behind the stomach and sits kind of right in front of the spine.
So it's right almost in the middle of the belly, maybe a little bit higher than that. 6 inches long. Is it straight like a tube or one side bigger than another?
So it is. It's almost like a boot that's turned upside down, where sort of the fat part of it is down this way and then it goes into a skinny tail.
So you've got a head and a tail of the pancreas. What's the purpose of the pancreas?
So the pancreas is there for two real functions. One is the exocrine function, which means it acts locally to help digest fats, carbohydrates, sugars, and proteins. And then the endocrine function acts systemically, basically throughout your body, to help you regulate your blood sugar.
So we've got insulin secreting endocrine, and then we've got digestive juices that come from the pancreas to help digestion. Digest carbohydrates?
Yes.
Digest proteins?
Yes.
Digest fats.
Yes.
So we really need those enzymes. Now,
absolutely.
Can people I know they can get cancer of the pancreas. What's it like?
So pancreatic cancer, unfortunately, there aren't a lot of early signs that go along with early pancreatic cancer. However, the most common symptoms that people have when pancreatic cancer develops is oftentimes very general or non-specific signs. Things like feeling very fatigued, weight loss that is unintentional, of course.
How much weight loss usually are we talking about? It doesn't matter. It can be 5 pounds or usually 20 pounds or 10 pounds?
Usually over 10 pounds at least.
And the fatigue, is it unbearable? Or they still feel good and they're losing weight?
It's pretty profound when this is going on. Oftentimes they also lose their appetite. And then you can oftentimes have some back pain or abdominal pain and back pain associated with this.
So why do they have back pain?
So the pancreas, as we said, it sits in the back of the abdomen, kind of right in front of the spine. It has a lot of very important neighbors there, and some of them are very important nerves that can send sensory or pain perception to different parts of the body. And so when it sits there and the pancreas and the tumor grows in size, it actually starts compressing those nerves.
And so it sends pain to the back, or you can have pain in the stomach. You don't feel good, you lose weight. Later on, anything happen to the color of the eyes?
So it absolutely can. So depending on where the tumor in the pancreas develops, if it encompasses in the head, which is this part over on this side of the pancreas, then it can obstruct the bile duct, which is the outflow of the liver. And that can cause you to have yellow skin and eyes, can change the stool color to a pale or pasty white appearance, or make the urine very dark.
The stool gets a pasty white. Why?
Because there's a product of breakdown product of your red blood cells called bilirubin, and the liver helps bring this into the stool to get rid of it when you don't need it anymore. When the bile duct is obstructed or something is pressing on the bile duct, which is how the liver is excreting substances, then basically you're taking that out of the stool, and so the stool has a pasty white color.
So pasty color to the stool, or diarrhea, losing weight, can't digest your foods, back pain, stomach pain, weight loss, just don't feel good. Those are a lot of symptoms, but we want to catch it really early. What are the earliest symptoms? The ones you mentioned first?
Yes.
So if people are not feeling well and they've got some pain in the belly, if it doesn't go away, it gets worse, got to see your doctor.
Absolutely.
And is cancer one of the things that the doctor thinks about when it's belly pain?
Absolutely. I think our primary care providers here in town have been excellent at diagnosing this earlier, as early as possible anyway.
So the primary care physician looks for that, and then when they need extra help, they come see the stomach specialist?
Yes.
Are you able to diagnose cancer of the pancreas by special tests?
Yes, you can. Well, typically the very first thing that is done, especially if there is a change in the skin color, the liver enzymes are often drawn early, and if they are elevated, that will give you a clue. After that, there's typically imaging that is done, including a CT scan, an ultrasound, or an MRI.
And that's what we're going to be talking about when we come back. There are special imaging and routine imaging factors that help us diagnose cancer of the pancreas so that we can find it early. And if we find it early, we can perhaps have a cure.
Yes.
You'll want to stay tuned. We're talking with Dr. Matt Moore, and we're talking about cancer of the pancreas. The pancreas is a gland behind the stomach. It's about six inches long. It carries insulin-producing cells, and digestive enzymes come out of the pancreas into the small bowel where it can help digest food. If somebody has cancer of the pancreas, they may have weight loss, they may have belly pain, back pain. That pretty much right so far?
That is, yes.
So let's talk about the diagnosis. If somebody comes to you with belly pain, weight loss, back pain, elevated liver enzymes, why would you get liver enzymes?
Because as the liver is draining, and it drains through a bile duct, which is the tube that carries the things that your body doesn't need anymore, and also bile to help break down fat, that if the tumor in the pancreas is compressing that bile duct, the liver enzymes will elevate.
So it could be an early diagnosis that way. Let's talk about imaging. What imaging do you get first? Do you get routine CT scans first?
Usually I will go to a CT early in this situation because it is such an important process to make a diagnosis early.
So what do you see on a CT scan?
So oftentimes you will see a mass in the pancreas, and then sometimes you will see that the bile ducts are actually swollen or dilated.
Whoa, so you can see the bile duct swollen on a CT scan?
Yes.
Are there special CT scans now that we can use, or what about an MRI?
So both of those tests are very helpful for that. There are CT scans that you can use special different imaging types to get a really dedicated view of the pancreas duct. And then an MRI oftentimes will pick this up as well. And then plus with the MRI, you get very detailed evaluation of the ducts that drain the pancreas that carry those juices to the bowel, and also the duct that carries the bile from the liver.
So when I see reports from a radiologist, or when I look at x-rays, they say always compatible with, suggestive of, maybe you have. So you have to go down and you have to really find out if that's the case. Is that right?
Absolutely. And then they'll oftentimes strongly word these as well. Our radiologists will say highly suspicious for a process like that.
So if it's highly suspicious, what do you do to help the patient? How do you carry the diagnosis further?
So the next step usually is trying to get a tissue diagnosis, or actually getting a piece of this cancer to actually confirm that that's what we're dealing with.
How do you do that?
So it really depends on the symptoms that the patient has. If they are yellow or have liver enzyme elevation, then oftentimes the very first test is what's called an ERCP.
ERCP. So what's the long word for that?
So it's endoscopic with a scope. There's no cuts on the outside. Retrograde, going back towards the liver or into the pancreas duct, and then cholangio, which is the medical term for bile duct, or pancreatography, which is the medical term for the pancreas.
Reviewing the pancreas. So ERCP, that's pretty easy for me to remember. The other word's too big. So ERCP, do you do an ERCP on patients?
Yes.
What's it like?
So they are completely asleep for the procedure and they don't feel anything during the procedure.
Certain position?
They are usually placed on their stomach for this procedure. And after they are asleep, we put an endoscope down through their mouth and go down into the small intestine, and then we try to gain access to the bile duct or the pancreas duct.
So you go down there and try and get access to are you looking for the access with x-ray, or do you have fiber optics?
There are good tools, or we have some clues where anatomy will kind of put you in the way where you need to go. But then we oftentimes we always use x-rays as well to help guide where we are going with these devices.
So when you're in there with an ERCP, what do you do?
So when we're there, we have little tiny devices that almost look like a coffee stirrer, and those are called catheters. And we will go up into the duct, and with an x-ray machine, we'll put dye in
What duct
there.
are you going into?
So we can go into either one while we are there.
By either one, you mean the pancreatic duct or the
Bile duct.
Okay, so if we're looking for cancer of the pancreas, you go into either one?
Most of the time we're going into the bile duct because we're trying to resolve that obstruction from the liver that the cancer is causing. So usually you're focusing more on the bile duct there, and you're trying to establish drainage there and also make a tissue diagnosis if possible.
Now I know the answer to this, but it's a pretty tricky procedure, isn't it?
It sure can be.
And it takes somebody that's had a lot of extra training. And so we really appreciate you who have had a lot of training come to the Dr. Bob Show to tell us what it's like. So you go with a little catheter up into the bile duct. How does that make a diagnosis?
So you'll first do is you put dye in the bile duct, and then you're actually able to see if there is a narrowing or it looks like something is pressing on that duct.
And you can see that with the x-ray
Yes.
at that time. Can you see something pressing when you're looking through the catheter?
Well, you'll just get the impression that something is actually occurring in that area.
Okay. So we still haven't gotten a biopsy. We can see strictures. How do we get tissue?
So when you see that narrowing right there, we can put a little brush, which is a wire-tipped brush, and actually scrape the inside of that bile duct and get some cells from that.
What kind of bristles are on the brush?
There are little brushes, or little metal wires on there that can help scrape some tissue from
So you
that.
scrape it up and down, you don't twist it around to try and get some tissue.
Yes.
And when you bring out the brush, you send that to pathology and they look under the microscope?
Yes.
And they're looking for abnormal cells.
Yes.
What we're looking for is no abnormal cells, so that the patient won't have that diagnosis. Is that a pretty good diagnostic tool? Is that a big advancement in ERCP?
That alone is not, but there have been some recent advancements. One of them is a new scope that there's actually a two-scope system where we use the big scope to get where we need to go, and then through that larger scope we'll put a smaller scope that actually we can go up into the bile duct and get direct visualization or actually see this, so I don't have to worry about the x-ray anymore.
What's that called?
That is called cholangioscopy or spyglass.
So that's a spyglass. How big is it?
It is very small. It is only about 2 to 3 millimeters in size.
So that's about half the size of maybe a pencil eraser or something like that. So when you go up there, you can actually see.
Yes.
And what do you look for? What does the cancer of the pancreas look like?
So we're looking for several different things. One can be ulceration, an ulceration is always an ominous sign or a scary sign when you see that. You can oftentimes see changes in the blood vessels in the bile duct, which makes you concerned that there is something happening in that area.
When you get the brushing, you can get the diagnosis. A couple other things I want to mention, and that's the ultrasounds. There's a new endoscopic ultrasound procedure. What's that, so people will know?
So that's called, that is called endoscopic ultrasound, or EUS. And what that is we will actually, there again, you're asleep for this procedure, and when on the tip of a scope, it goes down through the mouth and into the stomach and into the small intestine, there is a small ultrasound probe, which you're actually able to put right next to the pancreas. So you're actually able to see that in really high quality visualization to get an idea of what's going on.
I think that's neat. So it's another way of identifying what the tumor looks like. But the ERCP with brushing can give us a diagnosis. Do you ever have to go in and get a biopsy?
Yes, and endoscopic ultrasound has that capability, and typically it is with a needle that they place through the wall of the small intestine and actually into the tumor itself, and they're actually able to get cells that way to evaluate under a microscope.
So really the diagnosis is getting better and better. Finding it early can be the only way of having frequently having good positive results.
Yes.
I want to go back to the ERCP, and I want to switch away from cancer of the pancreas, because we've been talking about finding it early and what we've got to do. And by the way, you describe it beautifully. But tell me, what other things can you use ERCP for?
So ERCP can be used to treat disease processes in the bile duct, the liver drainage tube, or in the pancreas duct. Most commonly, what it is used for are people that have gallstones that are sitting in the gallbladder, and they roll out of the gallbladder and into the bile duct, which is the main channel that's draining the liver, and then they get stuck there.
So when they get stuck there, it blocks the bile juices, the stool turns white, you have digestive problems, pain?
Oftentimes, yes, very bad pain.
Bad pain. And so you can do the ERCP, this endoscopic, no surgery, going up there looking. How do you take the stone out?
So there's multiple different ways to do it, but typically you have to make a small little incision where the bile duct empties, and then you're able to either squeegee it out, almost like you're pulling a squeegee through that duct with a balloon, or you actually can crush the stone and then pull out the fragments thereafter.
I think that's so exciting. We're advancing so much. The gastroenterologist does so much to help people with new procedures like ERCP that you do, Matt. I want to appreciate your coming to the Dr. Bob and teaching us. You're a great teacher. Hope you'll come back.
Thank you so much for having me.
Wonderful discussion. If you've got belly pain, weight loss, maybe jaundice, be sure and think about the diagnosis of cancer of the pancreas, or at least having the proper diagnosis. And now you're going to want to stay tuned. We're going to talk about heart failure. You know, you could have heart failure, the beginnings of it, and not even know it. And the word microbiome, I want us to start learning that word. It's going to mean a lot about our health in the future. I want to thank Dr. Matt Moore. Wonderful discussion on cancer of the pancreas and the importance of early diagnosis. Now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, what are the signs and symptoms of heart failure? Well, when people look at the word heart failure, or they hear the word heart failure, they think that the heart has stopped. It's not the case. Heart failure means the heart is not working adequately. The heart has 4 chambers. There are 2 pumps. One of the pumps, the big pump, the left ventricle, pumps blood to the rest of the body, where it provides blood and nourishment and oxygen for the rest of the body. If that pump doesn't work good, if something makes that pump not do a good job, then you could have heart failure. The right pump, the right side of the heart, the right ventricle, can do the same thing. Its purpose is to get blood and take it up to the lungs where it can get oxygen to take it down to the big pump. So anything that goes wrong with either one of those pumps can create heart failure. What are the signs and symptoms? And what are some of the causes? So let's talk about the big pump, the left ventricle. It has to receive blood from the left atrium mitral valve. If the mitral valve is not working, it doesn't get enough blood, so it can't send out enough blood. If the muscle in the pump, the left ventricle, gets sick, myocarditis, inflammation, infection, then the pump doesn't work good. It gets dilated, doesn't pump efficiently, and so we get shortness of breath, and we'll go through symptoms in a minute. If somebody has coronary artery disease, where the coronary arteries have hardening of the arteries, it's not supplying the muscle of the left ventricle adequate nourishment, so it gets weak and doesn't pump well. So all of those things are some of the things that can cause heart failure on the left side. Other things would be aortic stenosis. The left pump pushes blood out of the aorta. If the aorta is stenosed, the heart just works and gets tired eventually. So there's lots of things that can cause the left pump to go bad. When the left pump goes bad, we get short of breath with activity. We get short of breath because blood will actually back up into the lungs, and we get short of breath at nighttime. We can't lay down flat. Our feet will begin to swell. We get short of breath by walking upstairs. We get more short of breath. We don't feel good. We are tired. So if you've got those symptoms, they could be early symptoms of the left pump, the left ventricle not working well. How about the right ventricle? Well, it's receiving blood from the rest of the body. So if that pump doesn't work, the blood will back up into the liver, and we get a swollen abdomen, and we get swollen ankles again. So all of the heart failure symptoms are shortness of breath, fatigue, weakness, and swelling of the feet. Who's at risk for that? Somebody that has for heart failure, somebody that has coronary artery disease. So watch your cholesterol, watch your coronary arteries. If you've got chest pain, see your doctor. Somebody that's got high blood pressure, know what your high blood pressure is. People with diabetes end up having small blood vessels in the heart go bad and the pump doesn't work good. So know if you have symptoms of shortness of breath, chest pain, swelling of your feet, that you have to talk that out with your doctor, and you have to ask him, is my heart not working right? It could be rhythm problems like atrial fibrillation. Lots of things can cause the problems. So work that out with your doctor. Question number 2. Dr. Bob, what's a microbiome? Well, that's a peculiar question because the word is a new word in medicine. But we're more and more understanding that there are good bacteria that are predominantly in the GI tract. Trillions of bacteria that are there. And the bacteria that learn to live in the GI tract are called microbiomes, or your microbiota. We get the bacteria very early in life. And so the bacteria, the good bacteria that are in the GI tract, seem to be responsible for how the immune system begins to work. And so it's very, very important that we allow that bacteria to work. Another reason not to overuse antibiotics. Antibiotics take care of bad bacteria, but when they do that, they can also take care of the good bacteria that we need. So there are ways to replace your bacteria in your GI tract, your microbiome, and we're going to be using those words more and more. So you can get some probiotics to swallow bacteria. Activia would be one, but there are some ones that are specific microbiomes. Align, A-L-I-G-N. All companies are recognizing the need for us to reestablish a normal bacteria flora in the GI tract. Now, as we're looking at the microbiome and how it affects our immune system, we're beginning to understand that as we breathe, there is a microbiome atmosphere that everybody seems to have that they carry around with them. That may be a reason why when we go on a trip, we expose ourselves to somebody else's microbiome when they sneeze, when they cough. That may be the way it's transferred to somebody else, is that one microbiome with bacteria can spread to another person and we can get an upper respiratory infection. Lots of things we're learning about that. But know that replacement of the GI tract with normal bacteria will end up being good for your health. It's all the time that we have for this show. Remember, we need to be exercising. What does exercising do? Well, it'll get your heart healthy where you won't have that heart failure. It'll make the coronary arteries perform better with exercise. It will take away stress. It'll help us lose weight. All of those things are going to help us with preventing heart failure. Also, when we perspire, when we exercise, we lose sodium. That's also good for our heart. We need to have 7.5 hours of sleep. If we're not getting 7.5 hours sleep, then we don't perform as well. We don't function as well. We don't think as well. We forget things. We become irritable. Our personalities change. So a lot of people can go to bed for 7.5 hours, but they don't sleep well. If you're not sleeping well, you need to think of causes. Could it be medications that you're taking, too much noise in the room, covers are not comfortable, somebody else in the bed is snoring or causing problems? So if you're not sleeping well, talk it over with your doctor. Remember to eat properly. Eat fruits, fibers, get rid of fatty, fried foods, and you'll watch your health improve. And most of all, what is it we like in the Dr. Bob Show? You know, it's that laughter in your life. I can't tell you how important laughter will be to you. If you laugh a lot, you'll be healthier, the people around you will be happier, everybody will perform better, and you will be healthier.